Mothers, thank you all for joining the Kids and COVID webinar this evening. Just wanted to give you a bit of information before we start. The webinar will be recorded and will be available via Digital Cheetah. Give the team 3 to 4 business days to upload. And if you have questions tonight, as opposed to using the chat function, please use the QA function because we will be addressing questions live. And some will be answered via the Q&A chat versus the regular chat. And now I'll turn it over to National President Cornisha McGill-Brown.
Thank you. Good evening and welcome to tonight's webinar. I am National President Cornisha McGill-Brown from the sweet Southeastern region under the leadership of RD Darlene Whittington, and I'm a member of the Columbus, Georgia chapter led by Pamela Watson. On behalf of the members of the National Executive Board, I would like to thank you all for joining us for this important webinar concerning kids and COVID. As you are aware, the health, safety, and well-being of our children and families have been primary concern in our organization throughout this pandemic. As an NEB, we have worked in collaboration with the Our Health Matters Task Force, the National Program Committee, the CDC, and other healthcare experts to provide updates and guidance on a uniform approach. This has not been an easy task, but we are thankful for the resources that have been provided, including new partnerships with the National Medical Association that you will learn more about tonight from our very special guest. I would like to thank NPD Sherelle Gross, NT Nadine Gibson, Chair Kiana Amos, and all of the members of the Our Health Matters Task Force, as well as Chair Bernard Alexander Rose and the entire National Program Committee, and Chair Vita Shazmi Dean for all of your assistance and support throughout this process. It is my prayer that we always remain informed and that our children, our members, and our families, as well as our communities, will be safe and protected. It is now my pleasure to turn the presentation over to our wonderful National Program Director, Sherelle Gross. Thank you.
Thank you, MP Cornisha. My name is Sherelle Gross. I am your National Program Director and pleased to serve in that role. I am from the mighty Eastern region where our Regional Director is Melinda Alexis Hayes, and I hail from the bold and brilliant Bergen-Passaic chapter in New Jersey. Thank you, mothers, for joining. As MP Cornisha so eloquently stated, this has been a very difficult road, but yet a road that we have traveled so that we can provide you guys as much information as possible. As we thought about answering questions about our own policy, what we equally thought would be important is that you can get information on what's going on in the current environment that we are in COVID, but how to manage COVID with children, but more importantly, what is going on in the medical field and in research with COVID. So it was such a great opportunity that we had in our partnership with National Medical Association. And thank you to Dr. Tracy Burgess from the Bergen-Passaic chapter to be a liaison for that partnership, as well as Carolyn Cookie Mason from the Greater Essex County chapter. And we are so very pleased that Dr. Tracy Rogo offered her opportunity to come and speak to the mothers. And we are so very happy. She is such an influential person in her field, and you will learn so much from her today. And so at the end of the webinar, you will have the opportunity to not only ask questions of Dr. Tracy Rogo, but you'll also have an opportunity to ask questions about our COVID policy. And again, I would like to also thank NT Nadine for being the NEB liaison for Our Health Matters Committee. And we are so very grateful to have such a great committee. And thank you, Chair Kiana Amos, for being such a wonderful chair and a wonderful partner in this effort. And so with that, I have the distinct pleasure of turning over to Chair Vita Shamson-Dean, who will talk about our partnership with National Medical Association. So Chair Vita, it's all up to you.
Thank you so much, MPD Sherelle. And good evening, mothers. I'm Vita Shamsuddin from the National Strategic Partnership Task Force, and I hail from the mighty Eastern region under the leadership of RD Melinda Alexis Hayes and our NEB representative, the dynamic NPD Sherelle Gross. I am also a member of the sensational South Jersey chapter under the leadership of President Jackie Lopez Perry. I'm very excited this evening to also bring warm greeting from the National Strategic Partnership Task Force under the leadership of our NEB liaison, National President Cornisha, who you heard from earlier, as well as our National Chair, Jasmine Smith. MPD has already recognized Dr. Tracy Burgess from the Bergen Passaic chapter, as well as immediate past President Cookie, Carolyn Mason of the Greater Essex County chapter for the work that they have done and the vision that they saw and helping bring the National Medical Association partnership to Jack and Jill. So we're very thankful and appreciative of their efforts. I'm so excited also because I want to give an overview of the National Medical Association and this partnership and really what is in it for our members. We know that we share common interests with the National Medical Association, which is to increase the representation of African Americans in medicine and in health sciences. We know by creating these pipelines and creating these leaders in medicine tomorrow that we increase the likelihood that there will be a reduction in health inequities and provide more parity for health issues for our communities. What about this? What are some of the other benefits of this partnership? And this is the piece that we're really excited about. We often hear about pipelines, but this partnership, one of the big focuses of this partnership is to create pipelines, STEM pipelines for our children and for the children in the communities where we live and serve. By creating these pipelines, we create diversity in the students who are entering the fields of medicine and health sciences. We know that the importance of creating pathways for our children, when we do that, just imagine a pathway that is lined with African American doctors that are helping our children see their greatness. They see what they can be, particularly as it relates to medicine. But this partnership will also provide mentoring opportunities, volunteer opportunities, and internship opportunities for our children. The National Medical Association has said that they would like to highly prioritize our children in their efforts to diversify this pipeline and seek them when they are looking for national and local volunteers for mentoring, for their network, and for their internship. But this collaboration is more than just the pipeline. It also will give our mothers a bird's eye view, which you will have tonight with Dr. Rogo, but we will have a bird's eye view with our national healthcare matters, our health matters task force in bringing African American doctors before us speaking on vital health issues that impact our communities, like kids and COVID, which you will hear tonight. So continue to listen. We will be providing additional information on the NMA and this partnership that we are so excited to bring with you with Our Health Matters Task Force. And now I also have the distinct pleasure of introducing remarks from the National Medical Association President, Dr. Rachel Villanueva. Dr. Rachel Villanueva is a clinical assistant professor of obstetrics and gynecology at NYU. She is the 122nd national president of the National Medical Association, the nation's oldest and largest scientific and professional organization representing African-American physicians and patients. Dr. Villanueva is a women's health expert and advocate who is committed to reproductive justice, health equity, workforce diversity, and disease prevention. She is frequently asked to share her expertise related to health disparities, health policy, and women's health. She is also an advocate for women in medicine and health sciences. She has always been committed to the mentoring of future physicians. She seeks wellness, not just for her patients, but for our community and our nation. And now we will hear remarks from Dr. Rachel Villanueva. Thank you.
Good evening, mothers of Jack and Jill of America Incorporated. I'm Dr. Rachel Villanueva, the 122nd president of the National Medical Association. The NMA is the nation's largest and oldest professional and scientific organization representing African-American physicians and their patients. I'd like to thank President McGill Brown and National Program Director Gross and our Health Matters Task Force for the invitation this evening. I bring you greetings and wishes of good health from the NMA membership and Board of Trustees. The NMA is committed to improving the quality of health among minority and disadvantaged populations, with our mission to advance the art and science of medicine through education, advocacy, and health policy. The NMA is looking forward to our new and fruitful collaboration and partnership with your organization. While we will promote health and wellness, equally as important will be our work together to increase the pipeline of students entering the health sciences. Unfortunately, we are still in the midst of the COVID-19 pandemic. This disease has particularly ravaged us, disproportionately impacting communities of color. While we have made great strides to improve education, access to care, and vaccine uptake, there is so much more we need to do to keep our communities healthy. Tonight, your leadership will review the current Jack and Jill COVID guidelines. An NMA Board of Trustees member, Dr. Tanya Rogo, a pediatric infectious disease specialist, will be here to answer your medical questions. I know your discussion will be informative and robust. On behalf of the National Medical Association, I wish you a wonderful discussion and look forward to a productive year together. Thank you.
Good evening, Jack and Jill of America, mothers, and all those attending our call tonight. I am so pleased to be joining you this evening. I am Nadine Gibson, your national treasurer, and I hail from the mighty Midwestern region under the leadership of our mighty leader, Regional Director Tanya Watson, and I'm also a proud mother of the Cincinnati chapter, where our marvelous moms are led by our marvelous president, Marcy Fitzgerald. I am here to talk a little bit about our Health Matters Committee, which I have the distinct pleasure of leading. The Our Health Matters Committee's mission is to educate and inform our mothers about health issues that impact our family and our children. As you can imagine, COVID-19 and the vaccine dominated our conversation this past year, and it should. This pandemic has had a significant impact on our families and our children, and as Jack and Jill, our ability to do programming. And with that, I'd like to thank NPD Sherelle and the entire programming committee for the foresight to host this call tonight to talk about COVID and our children. But before we do that, I have the pleasure of introducing the chair of the Our Health Matters Committee. She hails from the fabulous Far West region, and yes, indeed, she is fabulous. Chair Kiana also serves as president of the Inland Empire chapter, and as leader of the Our Health Matters, she helps champion those health issues that are important to our families. And so at this time, I'm going to now turn it over to Chair Kiana for the remainder of our program.
Thank you, NT Nadine. Again, welcome other members to this informative webinar. I'm Kiana Amos, Chair of the Our Health Matters Task Force, and yes, I hail from the fabulous Far West region, which is also home to our national editor, Florence Langford. We are under the leadership and direction of our regional director, Tasha Penny, where our theme is RISE, Leadership in Action, Anchored in Excellence. Over the past year, I've had the honor to work with a group of dynamic women on this task force as we've continued to support our organization in providing guidance on COVID-19. I'd like to take this opportunity to thank the task force members for all of their hard work and continued commitment to serving as a resource and ensuring that we provide up-to-date, relevant information to our mothers on COVID-19. We are so honored to serve under the direction of our national liaison, NT Nadine Gibson, and thank the National Executive Board for the opportunity to serve. Some of the efforts around COVID-19 that our committee has worked on have included a vaccine FAQ and a newsletter focused on COVID and keeping ourselves healthy during the pandemic and during the holiday season. We also provided input on the vaccine survey sent to membership and most recently worked on the COVID-19 resource guide. As we continue to navigate life throughout this pandemic, our committee is committed to serving as a resource for our mother members, and during this upcoming program year, we will highlight and address some of the disparities that make members of our community more at risk for COVID-19 infection. I now have the pleasure of introducing our guest speaker for the evening from the National Medical Association, Dr. Tanya Rogo. Dr. Tanya Rogo is a pediatrician who specializes in infectious diseases at Hasbro Children's Hospital, a teaching hospital of Brown University Alpert Medical School, where she serves as the Associate Program Director of the Fellowship Program in Pediatric Infectious Diseases, as well as the Pediatric Director of Antimicrobial Stewardship. Dr. Rogo was born in Kenya and completed her undergraduate education at the University of North Carolina at Chapel Hill, and then graduated from the dual MD and PH program at Tulane University. She completed pediatric residency at Inova Fairfax Hospital for Children and fellowship in pediatric infectious diseases at Brown University. She is board certified in both general pediatrics and pediatric infectious diseases. After fellowship, Dr. Rogo spent 4 years in Rwanda as Brown University faculty for the Human Resources for Health Partnership with the Rwanda Ministry of Health, where she helped develop the pediatric residency program at the University of Rwanda. In 2017, Dr. Rogo was the first recipient of the Belgie Young African Leader Award for the Consortium of Universities for Global Health. Dr. Rogo is an active member of the National Medical Association, where she currently serves as the chair of NMA Region 1. NMA Region 1 covers New England, New York, New Jersey, Puerto Rico, and the US Virgin Islands. Dr. Rogo is also a member of the NMA COVID-19 Task Force. In 2021, Dr. Rogo received the Top Physician Under 40 Award from the NMA. She also serves on several national committees of the Pediatric Infectious Disease Society. Thank you, Dr. Rogo, for joining us this evening. And at this time, I'd like to turn it over to you.
Thank you so much for that wonderful welcome. And good evening to everyone out there who's joining us today. And I'm going to speak to you about kids and COVID and leave some time at the end for questions. So as you're aware, we are in a pandemic of a lifetime where as of today, there have been 241 million cases of COVID-19 worldwide with 4.9 million deaths. And in the US, we remain #1 in the world with 45 million cases and over 700,000 deaths. And since the pandemic began at the beginning of 2020, we've learned several things about COVID-19 in children. We know now that children are more likely to be asymptomatic, meaning not having symptoms if they're infected. If they do have symptoms, they tend to have milder symptoms than adults do. And they're less likely to transmit the virus, meaning that if you have infections going on in a household, young children are less likely to be the ones who are transmitting the virus. We do know, however, that there are certain risk factors in children that put them at risk for severe illness and hospitalization. And these include asthma, diabetes, obesity, and having conditions which cause immune compromise. And as the pandemic has gone along, there have been new variants that have developed of the virus. And what COVID does, just like all respiratory viruses, is that it mutates. And with each new mutation, the new variants have been more infectious and have caused increased severity of infection, depending on the variant. And particularly with the Delta variant, we've seen an increased number of hospitalization of children. The new variants also are troublesome because they cause decreased efficacy of vaccines. But what we've seen with the Delta variant, which is the one that's now predominant in the United States, is that it's still protective in preventing severe disease and hospitalization. So the other thing that we've learned about COVID-19 is how it spreads, and knowing how it spreads has helped us understand how to protect yourself from infection. So the number one way that it spreads is through production of droplets. So when someone coughs and laughs or talks, they produce tiny droplets of sputum that contain the virus. And if you're standing within 6 feet of them or 1 meter, and not wearing a face mask, you're potentially exposed to infection. So which is why it's important to wear a face mask and also to practice social distancing of at least 6 feet. We also know direct contamination through direct touch, which is where hand washing comes into play and not touching your face, and also touching contaminated surfaces, which is where cleaning and disinfection is important. And one of the great scientific things that has happened with this particular pandemic compared to other previous pandemics like Ebola or Spanish flu 100 years ago is that we've been able to develop a vaccine. And so before I go into talking about the COVID-19 vaccine, I want you to first explain what a vaccine is. So vaccines help people gain immunity against infection. And the goal of vaccination is to create immunologic memory, so that when you see the pathogen through vaccination, your immune system develops memory cells so that the next time you happen to see the pathogen through natural infection, you have immune memory, which therefore acts much quicker in fighting the infection. And in terms of individual and community protection, vaccines help protect the individual who get the vaccine, but it also helps protect the people around them. Because as we know, there are sometimes people who cannot be vaccinated because they may have an allergy or they may have a medical condition for which may not allow them to get vaccinated, or they may simply be too young to qualify for the vaccine. But if the people around them who can be vaccinated are vaccinated, this forms what's called herd immunity around this person. And to illustrate further what herd immunity means, if you look at this picture here on the left, the person in red here, let's presume that they have COVID-19, and the people who are in blue are healthy and are not vaccinated. And the people in yellow have received the vaccine. So in a situation in which you do not have herd immunity, meaning most of the healthy individuals are unvaccinated, that one person who is infected can infect all of those unvaccinated people. But with herd immunity, if you had one person in the group who is not vaccinated and the majority of the people around them are vaccinated, even though you may have a couple of people who aren't able to get vaccinated, they remain protected because of this concept of herd immunity. And what the scientific models have suggested to us is that in order for us to reach herd immunity, we need to have 80% or more of the US population vaccinated. So right now, in terms of what is available in the US in terms of the COVID-19 vaccines, we have 3 different vaccines. We have the Pfizer and the Moderna vaccines, which are mRNA vaccines, and I'm going to explain in a minute what mRNA vaccines are. And then we have Johnson & Johnson. The only vaccine that's available for children, available under the age of 18, is the Pfizer vaccine, which currently is approved for age 12 and older. Though coming soon is age 5+, as the FDA is going to meet next week to discuss the Pfizer application for children aged 5 to 11. So how does the Pfizer vaccine work? So mRNA vaccines, so Pfizer and Moderna vaccines are mRNA vaccines or work via messenger RNA. And I want you to think of messenger RNA as being an email. What it does is that it sends a message to your body to create antibodies. So the messenger RNA carries the instructions that make the spike protein that sits on the surface of the COVID-19 virus. This spike protein is then taken up by your immune cells, which induce an immune response that creates antibodies against the COVID-19 virus. Afterwards, enzymes in the body degrade and dispose of the mRNA within hours. So it does not stick around in your body. It does not enter your DNA. It does not alter your DNA, nor does a vaccine contain any microchips, which are some of the myths that have been out there in social media. And to explain again in picture form, the spike protein sits on the surface of the coronavirus. And so this messenger RNA or mRNA carries a message to make the spike protein. It's coated in a lipid coating. And so when it's injected into a person, this mRNA then encodes making the spike protein, which is then taken up by immune cells and antibodies are made. So as we're all aware, with the initial authorization of the COVID-19 vaccines in December of last year, initially it was just for Pfizer, it was for 16 plus, and for Moderna and Johnson & Johnson, it was 18 plus. And since then, there have been additional studies enrolling children. And so Pfizer got their approval for age 12 to 15 based on their study in which they enrolled 2,000 adolescents, and they actually found the vaccine efficacy for this age group was 100%. While for adults, the efficacy based against the original, the alpha variant was 94 to 95%. And they also reported that the most common side effects in adolescents were consistent with similar trials in young adults and older teenagers, which is pain at the injection site, fatigue, headache, chills, muscle pain, fever, and joint pain. About 6% of vaccine recipients experienced an adverse event, and none of these serious events were determined to be related to the vaccine. There were no deaths reported within the trial, and there were no reports of blood clots, serious allergic reactions, or Bell's palsy. Bell's palsy is when you have paralysis of one side of the face. After the rolling out of the COVID-19 vaccine for adolescents, there started to be reports of myocarditis and pericarditis. So myocarditis is inflammation of the heart muscle, and pericarditis is inflammation of the membranes that line the heart. And these cases were reported to the vaccine adverse reporting system. So this is a system that has existed in the United States since the 90s for all vaccines in the United States. So if you have any event that happens after any vaccine, this gets reported to VAERS, and they look to see if that could be related to the vaccine. And so the CDC's Vaccine Safety Technical Group, which looks at COVID-19 vaccine safety data on a weekly basis, reviewed the data of carditis or heart inflammation related to the mRNA vaccines. And they concluded that there were reports of myocarditis, relatively few. And they also concluded that these cases were not more than what we see naturally. And I can tell you as an infectious disease physician, we typically see cases of pericarditis and myocarditis every year, usually from viral infections. And so they said that these cases seem to be predominantly in adolescents and young adults aged 16 and older, more often males, more often after dose 2, and typically within 4 days of vaccination. Majority of these cases completely recover. And so the CDC continues to recommend COVID-19 vaccination for everyone aged 12 and older, given the greater risk of COVID-19 illness and related possible severe complication. And one of these complications that we are seeing with COVID-19 infection is long COVID, with a large number of people who, after they recover from COVID-19 infection, continuing to complain of long-term complaints. So what else is in the pipeline? So Pfizer is doing their study for children aged 6 months to 11 years old. This started back in March 2021. And like I said earlier, Pfizer has submitted an application to the FDA for approval for the vaccine for age 5 to 11 years. That was submitted this month. And so the FDA is actually meeting next week to make a decision on this. So I anticipate in November, we should be able to start vaccinating children age 5 and older. One thing to note about the vaccine in this age group is that it's a smaller dose. It's a third of the dose given to adults. Moderna also is currently doing their study in adolescents, age 12 to 17. The initial analysis, they reported that there was a 96% efficacy in participants who received one dose, and that was well tolerated. And also their KidCove study for children aged 6 months to 11 years is also ongoing. Johnson & Johnson is also doing an adolescent study in age 12 to 17 years. So what has come out more recently is a recommendation for COVID-19 boosters. And this came out of data primarily out of Israel, suggesting that after 6 months, there may be waning of the immunity or amount of neutralizing antibodies that are produced by vaccinations. The group actually for whom this most affects is those who are age 65 and plus. This is where the evidence is the strongest, that if you're 65 and older, you definitely do have decreased number of antibodies 6 months out. And so this group is strongly recommended to get a booster dose 6 months after their initial series. The CDC also recommends booster doses for those who are 50 and older with underlying medical condition. And then also for people who have risks. So if you're 18 and older, living in a long-term care facility, if you work in a job that puts you at occupational risk, like a healthcare worker, and also if you have severe to moderate immune compromise. So patients with cancer, patients with HIV, these groups are recommended to get booster doses. To just address some of common vaccine myths that we've seen out there. So one is that people not wanting to get the vaccine because they were developed too fast to be safe. So it is true that the development of the vaccines happened quickly. However, the use of the mRNA technology has always existed. It's just that this was the first time that it was used for vaccination, and no steps in vaccine trials were skipped. What allowed these vaccines to come to market so quickly was that instead of them doing the trials in sequence like they typically do, meaning going from phase 1 to phase 2 to phase 3 to phase 4, they did all the phases at one time. Another myth is that the vaccine will alter DNA. And like I explained, the mRNA vaccine is messenger RNA, is like sending an email that you delete after you get the instructions. It does not alter DNA. Another myth is about delivering microchips into the body, which it does not do. A very common one that we've seen is about COVID-19 vaccines affecting future fertility. So with the initial trials, they did not enroll pregnant women, but there were study participants who fell pregnant while they're in the trial, and they had safe pregnancies with healthy babies. And since then, there are registries that are collecting information on women who received the vaccine, and the data shows that COVID-19 vaccination in pregnancy is safe. And one of the reasons why it's recommended for pregnant women, particularly to get vaccinated, is that pregnant women do have relative immune compromise. And so if you have the misfortune of getting COVID-19 while you're pregnant, that you have a high risk for severe illness and ending up in the hospital and in the ICU, which is why we strongly recommend pregnant women get the COVID-19 vaccines. And one of the unfortunate things that we're seeing is the Black women are unfortunately one of the groups that have the lowest COVID-19 vaccination rate in pregnancy. Another myth is that if you've already had natural infection, so if you've had COVID-19, that you don't need the vaccine. And so we encourage these people to still get vaccinated because the studies have shown that vaccination actually gives you high levels of neutralizing antibody. And another one is about not wearing a mask when you're vaccinated. And I think this messaging, unfortunately, became very confusing for people when the CDC gave the recommendation that once you're vaccinated, you don't need to wear a mask. We are still in a pandemic. There's still circulating virus. And so just to keep yourself safe and your loved ones safe, when you're indoors in a crowd, definitely you should be wearing a face mask. And we definitely recommend for children to be safe in school. One of the mitigation strategies is that they should wear face masks, and also all teachers and staff in schools should be wearing face masks. So why is it important for us to get our kids back to school and back into our extracurricular activities? It is important for academic instruction, right? So they can learn to read and write and all of those things they learn in school. Social and emotional development happens in school. And then one of the unfortunate things we've seen with the pandemic and when children are home from school was an increase in anxiety and depression and other psychological issues. And also just stunting in terms of social and emotional development. School is also another place that children get services such as speech, physical and occupational therapy, mental health services, and nutrition. Children with special needs cannot learn remotely, right? They need to be taught in person. And unfortunately, remote learning allows the inequities, societal differences to come into play, right? So families that can't afford a fancy computer, if you have parents who are illiterate or don't speak English, you can't navigate the electronics, it causes those children to fall behind. And so what keeps children safe so that they can attend school and attend extracurricular activities? So the overall data has shown that there's low rate of transmission in schools. And actually today I saw in the New York Times that in New York City, the transmission rate has only been 0.25%, right? So less than 1%, very low. And the reason that it's low is that we know we have mitigation strategies that work to decrease transmission. And you have to use all of these mitigation strategies. So universal masking, and the American Academy of Pediatrics, of which I'm a proud member, recommends this for children age 2 and older, right? So once they're cognitively old enough to understand a mask and to keep it on their face, they should be masked. Vaccination of those who are eligible for vaccination, adequate ventilation of classrooms, appropriate cleaning and disinfection, and of course, testing and quarantine. Anyone who is sick, not feeling well, should stay home and should get tested. And thank you so much for listening to me. And I'm now going to stop and I'll answer any questions that you may have.
Thank you, Dr. Rogo, for that great information on COVID-19 as it relates to our children and the vaccine, as well as giving us some wonderful information on what's to come as we look to see these approvals in the future. Mothers, we do have some minutes here to address any questions, and I see we have about 4 questions. So Dr. Rogo, I'll just read them out to you.
Yes.
Okay. So the first question is, if a child under the age of 12 has COVID, how long does their immunity last and can they get COVID again?
So the question about how long immunity lasts is an ongoing one. Generally, we know that it seems that antibodies last at least 6 months. The answer to that question is a little bit complicated because we know that just because someone's antibody levels may decrease may not necessarily mean that you don't have immunity, right? Because what your immune system is supposed to do is create memory cells so that if you see the pathogen again, it should activate the memory and produce antibodies again. So that's what makes that answer complicated. Can you get reinfected? Yes, you can. And particularly with each new variant that's coming out, they tend to be more infectious. And so just because, let's say you had COVID last year, you may have had COVID with the Alpha variant, does not mean that you cannot get COVID with the Delta variant. And so as long as we have new variants that keep circulating, yes, you can get reinfected. But overall, the reason why we really want people to get vaccinated is that vaccination is protective against hospitalization and death. Now, it's not 100%, but therefore it increases your chances of staying out the hospital. I know a lot of you may have heard the unfortunate news that Colin Powell had passed away from COVID-19 and that he'd been fully vaccinated. So it's not 100%, but it increases your chances of staying out of the hospital, which is why we want everyone to get vaccinated. And also vaccinated people have lower viral load, so they're less infectious than people who are not vaccinated.
Oops, our next question is the booster the same dose as the original shots? And what's the difference between the booster and the 3rd shot?
Okay, so booster is the word for the 3rd shot, essentially. So we have it's just terminology that we use. So when you get your initial shots, that's the primary series. So with Pfizer, Moderna, it's 2 shots. Pfizer, it's 3 weeks apart. Moderna, it's 4 weeks apart. So that's the primary series. And then now the recommendation is that you would then get a booster, which is the 3rd vaccine, 6 months after you finish the initial series, if you fall into the particular groups of people that it's recommended for you to get a booster.
Thank you. The next question is, can Dr. Rogo speak on any special outreach that the NMA is conducting with African Americans in COVID-19 vaccinations?
Yes, we are trying to do a lot. I can't tell you how many panels like this I have been on. So, today with Jack and Jill, I've done 100 Black men, I've done the Deltas, and all of us have been doing that, out there speaking to the community, going out into churches. We are out there, we're trying to talk to people. We do vaccination fairs, community outreach events. Those are the kind of things that we're doing. I think where we've not been great is been in the social media realm, because I think that's where a lot of the myths and the negative messaging about vaccines happening. It's on TikTok, it's on Twitter, it's in places that unfortunately the NMA hasn't really quite infiltrated. But we're out in the community and we're trying to advocate for people to get vaccinated.
Thank you. That's great. And thank you for joining us again tonight. That's great that you're doing such a lot of outreach in our community and keeping us safe. The next question is, what if your child has autism, is vaccinated, but won't tolerate wearing the mask? What can you do as a parent to try to continue to keep them safe?
Yeah, yes. So there are definitely children for whom masking just isn't possible. So I think if that is the case, definitely try as much as possible to have the people around them be vaccinated so that they have a protective herd immunity in the home. Ideally, I'm hoping they're in a school district that has mandated that teachers and staff get vaccinated, because that would also help them keep them safe. So if you remember what I said about herd immunity, right? That's what's important about herd immunity, is that not everyone in our community can get vaccinated. And what you want is those who can get vaccinated should do so to protect someone like this child who's autistic and can't keep a mask on. There was an incident that happened, I think it was in California, where there was a school teacher who was unvaccinated and took the mask off and was reading a story. I think they were like a class of 6-year-olds, and gave the class COVID, right? And at the time she was asymptomatic, she hadn't started to have symptoms yet, right? So it's incidences like that. Like I said earlier, children are not the ones who transmit COVID. It's the adults around them, right? Which is why we want adults who are working in schools, teachers, staff to be vaccinated.
Thank you. Another question is, do you think that children with a respiratory infection can be incorrectly diagnosed as having COVID?
So meaning that I assume the question means having like a false positive test. So having a positive test when you don't have COVID.
Yeah, right.
So with the PCR test, that shouldn't be the case. Because it looks for particles of COVID in your nasal cavity, right? So if it's seeing it there, it means that it's there. You may think that it's a false positive, maybe because your child is asymptomatic, but if they have a respiratory illness, then what's one of the symptoms of COVID? And so if they have symptoms that match COVID and they test positive for COVID, I would believe the test.
Okay. For a child who is 11 and a half, turning 12 in the next 3 months, should she get the adult vaccine or get the child vaccine when it's released?
So I don't think you'll have an option, because whenever you go, they're going to look at the age at the time and give what's indicated. So even if they're 11 and a half, they're still 11. And so they'll likely get the 11-year dose. But I do understand that question, because that's also sometimes something that I've had to deal with. Sometimes I have like a patient who comes in and maybe they're 17 and like 9 months, right? And I'm having to decide, actually I can't decide, because I'm not supposed to order the adult dose, even though they're virtually 18. So I think it's not really an option when you go to the clinic. They're just going to look at the age at the time and give the vaccine that's indicated.
Okay. I think we have time for about 1 or 2 more questions. So let me, here's a question here. What are the options if your child is allergic to the vaccine?
So if they have allergies, so they're allergic to components of the vaccine that preclude them from getting it, then obviously they're out of luck in terms of getting vaccinated. There are options in terms of post-exposure prophylaxis. So if you've heard of monoclonal antibodies, you may have heard Regeneron, which is part of the cocktail that Donald Trump got when he got COVID. He got a whole bunch of stuff, but one of them was Regeneron, which is a monoclonal antibody. So essentially it's an infusion of antibodies against COVID-19. So what I would recommend is if that child is exposed to COVID, is you can look up to see centers around you, usually an academic medical center may have studies ongoing where they can get a post-exposure infusion of Regeneron to help prevent infection. The other thing that you should be aware of is monoclonal antibodies are also used as an outpatient treatment for COVID. So if you are 12 and older and you get diagnosed with COVID and you are high risk for severe disease, right? So for a child, if you're diabetic, you're obese, you have asthma, congenital heart disease, chronic lung disease, neurologic disease, there's a whole bunch of conditions that will put you at risk for severe disease. Within 10 days of diagnosis, you can go and get a monoclonal antibody treatment. And that has been positively shown to keep people out of the hospital.
Okay, and our last question is it necessary for your child to have both the COVID-19 vaccination and the flu vaccination?
Yes, great question. Thank you for bringing in the flu. Yes. So last year we had a really mild, actually not virtually non-existent flu season because people were at home. And one of the worries is that now that people are out and circulating is that we may end up having a really severe flu season, and particularly children that are at increased risk. So for example, asthmatics, right? They're the ones that if they get influenza, they can get severely ill. So we're definitely recommending, the NMA strongly recommending that you should get your flu shot. Definitely get your flu shots. There's something else I was gonna say about the flu now. It's lost. It's slipped my mind. Oh yeah. So one of the things about why we think it's important for you to get the flu shot is what we've seen this summer is as the world has opened up and everyone has been back in circulation, is that we've seen particularly severe viral infections in children, right? Because if you think about it, there's children who are 2, 3, 4 years old have been at home and have been in daycare and preschool and kind of places where they would have otherwise been exposed to respiratory viruses. And so we've seen particularly bad cases of respiratory viruses this season, which is why we're afraid over the winter time that the flu season is also going to be bad. And so if you can get a flu shot, you're encouraged to.
Thank you, Dr. Rogo. Mothers, I see we have some more questions that we were not able to get to this evening, but we can take them offline and try to get them answered for you. So I appreciate your engagement this evening as we had this lively discussion with Dr. Rogo.
Thank you for having me.
Thank you. At this time, I'd like to turn it over to MP Cornisha, who will review our COVID policies with MPD Sherrill.
Thank you, Chair Kiana, and thank you to Dr. Rogo for that very informative presentation. You know, at this time, we are just going to entertain any questions that any of our members may have concerning our updated COVID-19 guidelines. As you all are aware, we have tried to keep you all informed concerning our policies. It has definitely been, you know, a challenge, unlike any other organization that currently, you know, really exists. It really takes a lot because we have to address the needs of not only our mother members, but really, our children. And we want to make sure that our children remain safe as we try to offer programming in the best way possible, but most importantly, the safest way possible. So we do hope that all of our chapters have been adhering to our guidelines, and we know that there have been questions, and we have done our best to try to answer those, even when it's on an individual basis or even through our more comprehensive guidelines that have been created through our packets that have been sent out to everyone. And I do want to thank our Health Matters Task Force for their support in making sure that this information was distributed to everyone in a very, what we hope is a very understandable way for you all to be able to relate it to your members and families within the chapter. So at this time, we just want to make sure that we answer any questions that you all may have, and I'll allow MPD Sherelle to chime in at any time concerning any of those guidelines that may be a question to you. And I will say that I know all of us have children who return back to school, and I think that Jack and Jill has definitely addressed probably more questions than most schools have addressed over this current fall as we re-enter school. So I do hope that you all have found it very beneficial as we try to keep our children safe. So MPD Sherelle, if there's anything else you want to add to that.
Sure, thank you, MP Carnicia. And I will simply add that you have your National Programming Committee with all your regional program chairs. You also have your MALs, your regional members at large, and they are there and available for you to help you through the guidelines, help you with programming activities if you need to do a virtual option as a comparable activity, help you design fundraising. So we are here to help you through the guidelines. We understand that it's a bit of an adjustment, but as Dr. Tanya Rogo stated, we are still in a pandemic, and we want to make sure that our children and our mothers and our guests remain safe. So just know that we're here to answer all of your questions. And if you need help with programming or fundraising, please feel free to reach out to your regional program chair as well as your MAL. And I do think that we do have a few questions coming in, and I will take the first one. MP Carnicia, is JJ looking at religious or medical exemptions for being able to attend events in person? I think you are referring to not being vaccinated and the inability to attend regional or national events. That question has been officially requested of the National Executive Board, and the National Executive Board, in consultation with Our Health Matters, will assess that question, and we will issue our decision on that those two particular exemptions.
Absolutely.
Mhm.
And I can't see the question, so I'm going to let you go ahead.
Oh, okay.
I don't think I'm on screen now. I just see you. I don't know if it's the camera.
Oh, okay. Another question that came in says, we are hosting an in-person informational luncheon for prospective new members at the end of the month. We have advised PNMs that as guests, they must be fully vaccinated and wear masks for our event. And mother members also need to wear masks for that event. We are requiring proof of vaccination in advance as they RSVP. Is this appropriate? We are not asking existing members to show proof of vaccination. Well, the existing members do not have to show proof of vaccination, but the guests must do so. I will ask that you speak with your vice president, your regional membership chair, to discuss the method in which you are collecting the proof of vaccination beforehand, just to make sure that it's done in a way that maintains the privacy of your guests. So we won't be able to answer that specific mechanism on this webinar, but please feel free to reach out to your regional membership chair or MVP Claudia Curtis, or to me directly to discuss that particular method. And you can also reach out to your Our Health Matters chair. I just want to remind you that you also have your Our Health Matters regional chair available to you for questions of that nature. So MP Carnicia, I'll give this one to you. We're just playing like, ping pong here.
That's
Is there
fine.
a policy concerning taking mass breaks during in-person activities?
Not at this time. The only time that we are allowing a break for mask is if there is food and you are, eating at the time, and that is the only time that we are allowing masks to be taken off. And it's just for the safety and well-being of everyone in attendance. Only at events where there is, food being provided.
Okay. So the next question, and this question also we have in our FAQ guidance as well, but I will I will state this question. Hello, please help us understand why you've made definitive rules regarding vaccination status for attending national and regional events, but are leaving it up to the chapters to make those determinations, when of course there are many different points of view. Why not mandate that the same requirement across the board? Let me first make some correction. There is nothing that the chapter actually, that determination as to vaccination status is not left up to the chapter. In the FAQs and the resource guide, we have definitive FAQs regarding the chapter's ability to request vaccination status. The only time that their question is posed is on the medical form. And that is an optional question, but that also is a question that only the program directors have access to that information, and they have that access in order to provide it to the regional and national leaders as necessary for regional and national events. I do understand that there has been, some questions regarding the difference between chapter events and national and regional events. We do indicate in the FAQ that with the regional and national events, it is a much larger number of attendees, where the chapter events are much smaller. In addition to that, it is much harder to do contact tracing in national and regional events, where chapters, we are requiring that attendance be taken. So that is the distinction between the chapter and the national and regional events, but we do not leave it up to chapters to make that determination. They are to follow the guidelines that we establish. I just want to make sure I didn't miss anything. And Cornisha, would you like to embellish on that?
No, that is correct. And just, the fact, again, just trying to, if there is, if anyone contracts, COVID in any way, it is much easier to contact those within your community than it is, within a regional national event. So we just want to make sure that we can have the proper, I guess with the regional and national proximity, it just makes it much harder. In other words, the community base is just so much easier to contain with our smaller events. So we don't worry about, having, to check in terms of those vaccination, card and procedures. But we definitely have to do it on the national and regional, events for the same reasons that MPD Sherrill just stated. Those are much larger events, and they just cover just a larger geographical area than your community wide too.
There is another question that is in the chat, and it says, why is a negative test required to return despite not being contagious? That's a really great question. After a positive test result, the guidelines do require that you do have a negative test result. And despite not being contagious, that is something that we cannot determine, one way or the other. So the policy that we have, after in consultation with Our Health Matters, determined is that after having a positive test result, that we do require that you have a negative test result in order to resume Jack and Jill of America activities. And I'll leave MP Cornisha and Chair Kiana can embellish on that if they desire.
I agree with your statement. Chair Kiana, do you want to add anything to that based on the negative test and return?
I have nothing to add.
Okay, and I think we'll just answer one other question. This is a great question. We are looking to invite a speaker to a chapter event. Is this considered a guest or a vendor? It depends on the circumstances, but probably a guess. Vendors are more dropping food off, coming to, do something that is strictly like a vendor related activity, but not someone that is going to come in, interact in a substantive way, with the chapter, with our children. In that particular case, we desire that the guests be vaccinated. But certainly reach out to your regional program chair or your regional membership chair, and they can provide a little bit more clarity depending on the circumstances. Often, obviously guidelines don't cover every circumstance. So in those particular situations, it is prudent just to contact your regional membership chair or your regional programming chair or your Our Health Matters regional chair, and they will provide some guidance on those particulars for you. And can children, parents be, I think we did that one, right? Can children, parents be exempt from mask wearing? If so, when? MP Cornisha answered that one already. And MP Cornisha, if you want to repeat your answer for that, that would be great.
Oh, no, we are requiring that masks be worn at all times, except for events where there is food being provided, where you will have to take mask off, of course, to eat or to drink. But we ask that you put your mask, right back on once you have finished the meal. So that's the only time.
All righty. There is a question regarding Florida. I see the question, I acknowledge it. If you can just please email me that question directly. And MP Cornisha, that is the question in the state of Florida. It is unlawful to require vaccination to attend an event, no vaccine passport. What accommodations are available under the current guidelines, or are guests simply not an option? If you can email that question did come in through, I think, one of the RPCs. I don't know if it was Florida or it was Texas, but we will be discussing that particular question with our National Legal Advisor and with the National Executive Board. But thank you for that question. It's a great one. Okay, so I guess this brings us to the end of this webinar. I hope that it was informative for you and that you were able to get some of your questions answered. And we will take the questions and see if there's an opportunity for them to be answered. We can't make any promises because Dr. Tanya Rogo gave us, her time tonight, but we will certainly see what the questions look like and if there's an opportunity to get them answered in another way. But before I turn it over to MP Cornisha, again, I would like to thank the National Medical Association for this partnership. We're so very excited about it. And especially thank you to Dr. Tanya Rogo for your time and your commitment, to children. We appreciate your efforts in making sure children stay safe, and appreciate, of course, Our Health Matters and our Strategic Partnership Chair for all that you do for our children and for our mothers. And with that, I am going to turn it over to our illustrious president, National President Cornisha McGill-Brown.
Well, thank you so much, MPD Sherelle. We definitely appreciate everything that you do for our organization. And as we prepare to end tonight's webinar, I also want to say a very special thank you to our special guest, Dr. Tanya Rogo, for sharing your time and expertise through this very informative presentation. And we are so thankful for this partnership with NMA, and we look forward to future opportunities of keeping our members informed on important issues concerning our health. And thank you to all of the members for joining us. And most of all, thank you for doing your part to support our efforts in keeping our children, families, and communities safe. Have a wonderful night and a blessed week. Take care. Bye-bye.